Welcome to Clinicals with PharmVic. Today we will be learning about acetazolamide. This belongs to a drug class called systemic carbonic anhydrase inhibitor. Its mode of action involves inhibiting carbonic anhydrase, which reduces aqueous humour production, thereby lowering intraocular pressure. This inhibition also leads to carbon dioxide accumulation in the brain, reducing neuronal activity. Furthermore, it causes mild diuresis and metabolic acidosis, which increases respiration rate and improves oxygenation at high altitude. Acetazolamide is indicated for acute reduction of intraocular pressure, such as perioperatively or during an acute angle closure crisis. It's also used for chronic open-angle glaucoma when other treatments have failed, and as an adjunctive treatment for refractory epilepsy, including menstrual-related epilepsy. An accepted indication is the prevention of acute mountain sickness in those at moderate or high risk. Precautions include contraindications for adrenal or respiratory failure or metabolic acidosis due to increased risk of profound acidosis. Hyponatremia or hypokalemia are also contraindications, as acetazolamide may worsen electrolyte disturbances. Allergy to sulfonamides may increase the risk of allergy to acetazolamide, with manufacturers contraindicating its use. For renal considerations, it's contraindicated when CrCl is less than 10 milliliters per minute, and the dose should be reduced if CrCl is between 10 to 50 milliliters per minute. Acetazolamide also increases the risk of recurrence of urolithiasis. In hepatic impairment or cirrhosis, it's contraindicated due to the risk of hepatic encephalopathy. Elderly patients face an increased risk of adverse effects such as metabolic acidosis. For pregnancy and breastfeeding, it's advised to contact specialized medicines information services. Common adverse effects include paresthesia, fatigue, drowsiness, depression, decreased libido, and a bitter or metallic taste. Other common effects are nausea, vomiting, abdominal cramps, diarrhea, polyuria, renal stones, metabolic acidosis, electrolyte disturbances, and rash. Rare adverse effects include ocular effects like transient myopia, severe skin reactions such as Stevens-Johnson syndrome, and blood dyscrasias like aplastic anemia. Other rare effects are thrombocytopenia, agranulocytosis or neutropenia, anaphylaxis, and non-cardiogenic pulmonary edema. For acute reduction of intraocular pressure, adults typically start with 250 to 500 milligrams orally or intravenously, followed by 125 to 250 milligrams every 4 to 6 hours, with a maximum of 1 gram daily. For chronic open-angle glaucoma, adults start with 125 milligrams twice daily orally, increasing to a maximum of 250 milligrams 4 times daily. For epilepsy, specialist advice should be sought. A common dose for adults and children over 1 month is initially 4 to 8 milligrams per kilogram daily, increasing up to 30 milligrams per kilogram daily in 2 to 4 doses. For prevention of acute mountain sickness, adults take 125 milligrams twice daily orally, starting the day before ascent and continuing until acclimatized or descent begins. In renal impairment, for CrCl 10 to 50 milliliters per minute, halve the dose or double the dosing interval with a maximum of 250 milligrams twice daily. Intravenous injection should be given over 3 to 5 minutes, as its high pH can lead to tissue damage if extravasation occurs. Practice points include checking renal function, electrolytes, and complete blood count before starting acetazolamide, and monitoring regularly for prolonged use. When used for epilepsy, tolerance may develop with continuous use, and it can be given intermittently for menstrual-related epilepsy. Consider acetazolamide for prevention of acute mountain sickness when rapid ascent is unavoidable. Although still marketed as a diuretic in heart failure, other agents are generally preferred. This is the end of today's lesson. Share this video, like, and subscribe. Let us grow together, learn, study, and revise.